Hi dear friends, I am Dr. Sanjay Verma. I am a senior consultant in Department of Minimal Access, Bariatric and GI Surgery, Fortis Escorts Hospital. Our hospital is a very well renowned hospital, as you know, and we are offering all basic advanced laparoscopic surgeries along with the weight loss surgeries. The surgeries which we are doing is all routine surgeries like gallbladder, hernias, appendix, advanced colorectal surgeries like cancer of colon, cancer of esophagus, cancer of rectum, cancer of small and large intestine. Apart from this, cancer of small intestines. We are doing very good number of cases of weight loss and metabolic surgeries. Weight loss surgeries like called as bariatric surgeries. Bariatric surgery is a revolutionary step nowadays. Any patient who is not able to lose the weight in spite of all his efforts, we offer the patient the bariatric surgery. This is the weight loss surgery. There are various variants of this surgery, various types of the surgeries. Like young patient whose aim is just to lose the weight, marriage going age patient, male or female, the laparoscopic sleeve gastrectomy is the best procedure for that. How we decide the patient to be fit for the bariatric surgery or not is the calculation of a BMI. Any patient above 32 BMI with 2 or 3 comorbidities, and in spite of all their efforts to lose the weight, if they are not losing the weight, then we offer the patient the surgery which is called as bariatric surgery. In a young age group where the aim of the surgery is just to lose the weight, the sleeve gastrectomy is the best procedure. In this laparoscopic sleeve gastrectomy, there is small 5 holes in the abdomen. Overall, the procedure is about 1.5 hours, and there is a 3 days package available for that. The patient is being admitted after the pre-op workup on the day of the surgery. We do the procedure. On the first day, patient is on the ICU. Next day, we shift the patient. After patient being shifted to the room, we get the test which is called as NCCT of abdomen, just to check if there is any leak or any other problem on the operated site. Once the NCCT of abdomen is fine, we allow the patient liquid to be taken. We keep the patient for 2 more days. On the 3rd day, patient has been discharged. We call the patient after 7 days for the follow-up, and we give the patient a proper regime for 3 months initially. In this regime, initially for 3 weeks, patient is on a liquid diet. Stepwise, we put the patient on a semi-solid diet for coming next 3 weeks. After that, we start the patient with the normal diet for after this 3 weeks on. So initially for 3 weeks the patient is on a liquid diet. Coming 3 weeks after that, this patient is on a semi-solid diet, and after that patient is on a normal diet. What we observe, patient loses the weight very significantly and to a satisfactory level. As per our observation, initially for a period of once the surgery is been done, every month patient used to lose the weight around 6 to 7 kgs a month, and that's a very good achievement for the patient who is trying to lose the weight. In spite of that, he is not losing the weight. And whatever the services which we are providing, this is for the weight loss. Apart from this, the patient who is obese, obesely morbid, having morbid obesity, in spite of that they are having diabetes, hypertension. There are another procedure which is called as Roux-en-Y gastric bypass and mini gastric bypass, MGB procedure. This is for the patient who are of a higher BMI, having diabetes. In spite of this, they are not able to lose the weight. There is a basic difference between the sleeve gastrectomy and bypass is that in bypass the weight loss treated diabetes as well, and patient is on a multivitamins for lifelong. But in sleeve gastrectomy, the initial weight, after the initial weight loss, there is no after 3 months there is no requirement of any multivitamin supplement or any other supplement, because we don't disturb the anatomy. It has been observed after the bypass surgeries, bariatric surgeries, any type of it, diabetes, hypertension, everything resolves to a to the maximum extent, and the patients are really happy. We have the patient data. We are having the patients who, after getting the surgery done, their lifestyle completely changes, drastically changes. You can say the patient has, suppose before the surgery, we can count the patient as a 2%. After the surgery, we take one person out of that patient, so that once the weight is lost, patient is become active. If the patient is having diabetes, hypertension, OSA means that is the problem of sleeping. He is having apnea, having like breathing problem while sleeping. This all improves very drastically after the surgical procedure. I would like, but it's just not possible to show the patient who has done with the surgery and their life has been changed drastically. In the meantime, in future as well, if anybody wants to come and show himself his own experience regarding the surgery, we'll definitely share with you. Nowadays, bariatric surgery is such a procedure that once it has been done, the life totally changes. As far as the cost purpose is like contained and all, in other countries, our country is having a very cheaper rates, good result, efficacy is same, and patient comfort is much more here. If we compare it with US, we compare it with Singapore, we compare it with any other country, the charges, the services which we offer is tremendous. We are having a lot of international patients coming from Middle East countries, coming from Australia, coming from Nigerian countries, Middle East countries like Iraq, Afghanistan, like African countries. We are having a good number of the patients coming from there, getting their treatment and going back to their country very happily. As far as cost is concerned, they are much more happy getting the treatment here and going back to their country. They are in constant touch with us by email, by calling us, by having any information regarding their health and all to our international desk. So I would suggest, I will say, we are really happy to serve these patients, and the vice versa. The patient is also happy to come to our country and getting the treatment. Apart from this, we are a advanced center for all colorectal surgeries. Colorectal surgeries means any patient who is having the cancer of colon, like if the patient is having cancer of ascending colon, sigmoid colon, transverse colon, rectum, we are treating it with laparoscopy and robotically.